So now we're going to demonstrate how to do the assessment of the peripheral and cardiovascular systems. So for the peripheral system, I'm looking at her nail beds. And I'm looking for the color to see if they're pink or if they have a bluish tint. And then I'm going to do capillary refill, which means that you press on the nail and the area should blanch white. And when you release the nail, then it should come back pink. And I'm trying to note how many seconds it takes for it to go from the blanching back to pink. And hers is less than 3 seconds, which is a good finding. I'm also going to have her put her fingers together like this. And I'm looking to see if she has any clubbing. So there should be a space in between her nail beds. And if she had clubbing, there may not be. And so that's one thing that I'm looking for, which might indicate she has some cardiovascular issues and peripheral vascular issues. The next thing I'm looking for is edema. So I'm looking at her hands for any edema. And I'm also looking at her ankles. And I just press lightly to see if there's any indentation. And her feet to see if there's any edema there. And she does not have any. And so then the next thing I'm going to do are all of her pulses. And now when you're doing your physical assessment, you would stop and count each pulse for 30 seconds and multiply by 2, except for the apical pulse, and we'll be doing that when we do heart sounds. And so I'm going to start up here with their temporal pulse. And I would count it for 30 seconds, but I'm also not only noting the rate, but how strong it is, how rhythmic, and if it's consistent side to side bilaterally. And it is. So that's the temporal pulse. Then I'm going to go down here to her carotid pulse. And on her carotid pulse, I don't want to check them both at the same time because you can impede blood flow and may cause her to be dizzy or to faint. So I don't want to do them at the same time. But again, I'm going to reach, feel for her carotid pulse, which I feel right there. Again, noting the rate, if it's rhythmic, smooth, strong, weak, or bounding on both sides. And I'm comparing them side to side. So after I do those, then I come down here to the brachial, and it's on the inner aspect of the arm. I feel for it. I always do both sides. And remember, you can do them at the same time. And you can feel if they're consistent and the same on each side. And then I'll do the radial, which is on the thumb side of the hand. And I can feel them at the same time. And then the next one would be apical, which we're going to do when we do heart sounds. And then the femoral pulse is when the leg comes up and meets the, and it's the groin area. And I feel on both sides. Again, feeling for the same things I felt all the other pulses for. The next one is the popliteal. Now the popliteal pulse can be difficult to feel. And so I like to press it between my two hands to see if I can feel it. And so my fingers go behind her knee, and I press together to try to feel her pulse. And then I want to do both legs. And after popliteal, and I'm going down here to the dorsalis pedis. And so you can start either down here or up here. I like to start with the toes, between the big toe and the next toe. And I just start feeling until I feel it. Or moving up until I feel it. Feel it right there. And then the last one is the posterior tibia. So here's her ankle bone, so I'm going to go right behind it. And I feel it really nicely right there. And I feel it nicely there. And so again, I'm assessing our pulses for the rate, the rhythm, and the strength, and if they're bilaterally the same.